Hi, my name is Amanda Yang. I'm a dual degree Doctor of Pharmacy and Master of Public Health student graduating in May 2021. My project focused on the role of pharmacists in expanding access to hormonal contraception. I completed my project at the Pharmacy Society of Wisconsin, or PSW. This project revolved around the pending passage of Assembly Bill 304, Senate Bill 286, which would have allowed pharmacists to independently prescribe specific hormonal contraception to women ages 18 years and older. The bill made it through the Assembly and was in the Senate when the 2019 or 2020 legislative session was shortened due to the COVID-19 pandemic. So unfortunately, the bill didn't pass, but luckily, it was reintroduced in the 2021-2022 legislation and is now known as Senate Bill 30 and Assembly Bill 36. The topic of expanding access to hormonal contraception has always been a public health issue. The CDC considers the use of hormonal contraception for family planning one of the top 10 public health achievements of the 20th century. The CDC has stated that increased access to hormonal contraception and the proper usage of hormonal contraception are key to preventing unintended pregnancies. The American College of Obstetrics and Gynecology, or ACOG, has also stated that pharmacists prescribed contraception is one strategy to promote access and prevent unintended pregnancies. Expansion of the pharmacist's role has greatly benefited public health in the past. Pharmacists have assisted with immunizations, tobacco cessation, health screenings, pain management, and providing patient education. Currently in Wisconsin, pharmacists are able to prescribe hormonal contraception only if the task has been delegated by a physician or authorized provider via something we call a collaborative practice agreement, or CPA. Senate Bill 30, Assembly Bill 36 would allow pharmacists to prescribe without a CPA, opening up the opportunity for all pharmacists, not just those who have been delegated the task. Wisconsin is not the first state to consider this legislation. In 2016, Oregon was the first state to pass legislation to allow pharmacists to independently prescribe hormonal contraception. California passed legislation later that year. And as of 2020, 14 jurisdictions have passed similar legislations, which vary by the state. And these jurisdictions include California, Colorado, District of Columbia, Hawaii, Idaho, Maryland, Minnesota, New Hampshire, New Mexico, Oregon, Utah, Vermont, Virginia, and West Virginia. A big takeaway from this project is that there are pharmacists who are interested in expanding their scope and supporting the public health issue of improving family planning and access to reproductive health care. PSW is working with lawmakers and members to prepare for this expanded role. Right now, the bill sits in the Senate and is waiting to be scheduled for the second reading. The public can contact their representatives, increase awareness on the bill, and hopefully gather enough support that Wisconsin lawmakers will consider voting yes on the bill. Thank you for taking the time to view my digital story. If there are any questions, please feel free to send me an email.